Hello, this is Gabriel Sines again, our final week for introductory psychology here. We're going to be looking at different types of therapies. Now, this is kind of a cumulative chapter. There's not a heck of a lot of stuff in here that is totally new. A lot of the concepts we've seen before, we've talked about before, or at least we've mentioned them. I've tried to keep this chapter short and pared it down so that we don't have a bunch of repeat vocabulary terms, and the chapter itself is not super long. So I'll just be going through and putting down all the therapies, or at least a good overview of the majority of different types of therapies in psychology for helping people get over the disorders described in the previous chapter. Now, it's important to note that these therapies are not just applicable to disorders. Therapy is something that pretty much everyone can benefit from at any point in their lives. Therapy is something that can improve the quality of your life regardless of if you have a clear, distinct problem or not. It's almost like saying, when should I seek medical advice? You don't want to just seek medical advice when you're sick. It's good to keep a checkup, once every couple of months. It's good to follow medical advice, like try to stay healthy, eating right, and doing exercise all the time. And so therapy is something that's not necessarily just for when you have a problem. There's a lot of ideas and practices that you can take away from therapy and use even in your day-to-day, kind of as a preventative form of care, so that you can practice these therapy techniques so it never gets to a place where it's a huge problem. Of course, we all are going to run into problems. Something like 80% of people experience a major disorder in their life, and it's close to 100% of people experience some sort of minor disorder in their lives at one point or another. So it's wonderful to just be aware of what options you have and be familiar with them, because a lot of people have a little bit of a stigma against seeking therapy or seeking any sort of psychological counseling because they're afraid that it's only for people who are crazy or whatever. You're familiar now with the previous chapter's information demonstrating there's a lot of ways to have disorders that you're not crazy for having. And if I can be so bold as to say, there's some situations where you are crazy, but that's okay. It's something that you can work on. You shouldn't feel bad if your car is totally broken, and you shouldn't feel bad if you were in a position where you could use some help either. But there's nothing wrong with maintenance here and there. So let's get started. The sections in this chapter include, first, just a brief overview of the different types of therapy and the tools that those therapies use. That's going to be the majority of the chapter. Then we're going to have three short sections towards the end. A section talking about whether or not therapy works, whether or not how different types of therapies are, and whether or not you should choose one or another type of therapy over another one. We'll take a brief look at biomedical therapies. That's the medicine side of psychology or psychiatry. It's actually quite a short chapter, because what you need to know as a consumer is not that complicated. If you're going into the area of psychology where you would like to learn more about this, there is so much you can look at. But just as an introduction, it's not too long. And finally, we'll have just maybe a very brief talk about preventative care and wellness. To be honest, that's not so much of a section as something that we will be mentioning throughout the whole chapter. So let's get started. First, subdivisions of therapy. There are two overarching sections to therapy. There is psychotherapy and talk therapy. So psychotherapy is just kind of a name for therapy. It's easy to confuse that with psychoanalysis, which is the Freudian area of psychology. Psychotherapy just means anything performed by a counselor or a therapist or any sort of mental health professional that you do, or something that you do for yourself, designed to help you overcome problems, deal with problems, or grow personally through conversation or practices. Biomedical therapy, on the other hand, is taking medicine or doing some sort of direct biological approach to working through those problems. Psychotherapy can be talked of as talk therapy, because mostly what you're going to do there is talk to someone or talk to yourself to try and work with things. Our next vocab term, kind of a really obvious one, is the eclectic approach. It means any type of therapy that involves targeting issues through multiple forms of therapy. So that's not just talk versus biomedical, but using one or multiple approaches from the list that we're about to look at, or one or more types of tools or methodologies. Um, Whenever you go through any sort of therapy, it's always a good idea to use an eclectic approach. Whenever you're trying to improve your own life, the way that you think or how you feel, it's always good to use a variety of options, because some things will work for you, some things will work better for other people. And there's never going to be a situation where you have the best choice. Something might work for you now, but be better. A different choice might be better for you later on. So the idea of the eclectic approach is just to be aware that it's good to have multiple avenues towards success. All right, so let's get started on specific types of therapies, and the first one, probably the oldest one, is psychoanalysis. This comes from Freudian research. Psychoanalysis is the Freudian therapeutic technique. It has two major components to it: resistance and interpretation, that we'll talk about in a moment. And the main idea behind the Freudian technique is to uncover repressed feelings, or figure out where your problems are coming from, to try and gain some insight into why you're experiencing some problems. Freudian analysis, or psychoanalysis, is kind of an older school of psychoanalysis, so it's not necessarily your most commonly used system. It's not necessarily your most effective system, but it is one that still even is in use today. There are more modern versions of it. The main components of psychoanalysis include resistance and interpretation. So resistance is the idea that people don't want to think about stuff that is tough for them, or things that make them anxious. So they may either block that information away, or they may have resistance to thinking about it. Freudian analysis, or psychoanalysis, has a lot to do with uh, things that happened in childhood or really early age. So you may forget things, or you may forget things because they were stressful or anxiety inducing. So a lot of the ways that psychoanalysis is supposed to work is you may have repressed a memory. Say, for example, you talking with your therapist, you realize that your dreams are telling you that you were abused as a child because your parents neglected you, or something like that. And so the resistance component is the idea that you forgot about that, you don't really think about it, or you don't want to think about it. The interpretation component is that that information is still available to you, but in sort of a metaphorical system. So it might appear in your dreams, it might appear in your behaviors or in your thoughts, and it needs to be interpreted kind of like a metaphor is interpreted in a book. But the ways there that the idea is that we have these kind of unconscious or subconscious ways that our brain or our mind or our body is telling us that we have these problems from our past that we just aren't dealing with yet. Two more components for psychoanalysis are the ideas of transference and, of course, how psychodynamic therapy works. So transference is the idea that our past problems affect our present self in some way, very much like that the idea of interpretation and resistance. You can kind of see those ideas here. So a wonderful example of transference is if a person had their parents tell them at some point that their parents said, "Oh, I can't deal with this," and so you as a child took that to mean that you are too much to deal with, but you kind of would repress that information. So in uh, you would internalize the idea that you're too much to deal with, and repress the notion that it came from your parent. And so the psychodynamic therapy would work to try and uncover A, why you feel those feelings, and where they come from, and B, to help you get over them. So help you get over this phrase, which might have been just a throwaway moment thing that your parents did, but that affected you negatively. Okay, so the idea of transference is something in your past has hurt you, and you present that in a new way. And psychodynamic therapy is the idea of uncovering those problems through understanding transference, resistance, and interpretation to help you get over that. And so it helps you, the main idea behind psychodynamic therapy is to try and help you get over past issues that are causing present problems. So we have a couple slides. There's a lot of words in this PowerPoint. I try to avoid that, but because this is a very uh, there's a lot of information that you won't really necessarily encounter unless you participate in therapy. I thought the best way to include this information was in terms of words, but just to make things easier for you, I will try and read these out or let you read them if you would like to on your own time. So this one, the goal of psychodynamic psychotherapy is to help people become aware of when unconscious feelings are influencing their behavior so they can consciously make healthier choices. Kind of what I was just talking about. And just to clarify, the words psychodynamic or psychoanalysis are confusing because they sound a lot like psychotherapy. And I just want to clarify that now. We'll start with psychotherapy. Psychotherapy is any type of therapy for psychological problems. We use psychotherapy to denote the fact that it is for psychological issues, as opposed to like physical therapy that would be for some sort of impairment that you want to get over, or you know, like retail therapy or some other type of therapy. Psychodynamic or psychoanalysis is often going to be Freudian related, uh, is a term that means that it's related to the Freud type of therapies, although sometimes psychodynamic therapy describes overarching goals of any type of therapy, which are often going to include something about recognizing where your issues are coming from and trying to get over them. So here's an example of a psychoanalysis therapy and how it might help you. So in this case, the example is for Jeffrey, the client, and you want to avoid calling your clients in any type of psychotherapy patients because there's a stigma to the word patient. So a lot of therapists will call the people that come to them clients or just call them people, so that folks don't feel as though there's something wrong with them for seeking out help. Um, Although, to some extent, it's almost like a medical situation. There's nothing wrong with you if you broke your bone, and there's nothing wrong with you if you broke your head. So the client Jeffrey began responding to me as if I was an unpredictable, angry adversary. So Jeffrey has anger issues, and they respond to their therapist in that way with apparently no real cause. Seizing the opportunity to help Jeffrey recognize the relationship pattern, the therapist helped them explore the pattern's roots in the attacks and humiliation he had experienced from his father. So in this case, the person had experienced emotional attacks when they were children from their father, and so they turned around and do that to other people. Then they've grown up, and that's how they identified where's the source of the problem, what the problem is, and to try and get over it consciously. So a major component of just about any type of therapy that we're going to be talking about today is insight therapy. And insight therapy, or the idea of insights in therapy, is just the idea that when you're, as a person, and if you're experiencing some sort of psychological problem or disorder, a lot of the times it's hard to look at that and notice it. It can be really, really hard to notice that your room is dirty, but it's really obvious if you look at someone else's room and it looks dirty. And the reason for that is that you live with it, and when you live with a problem or you experience it or it comes on slowly, it's hard to notice. And so a lot of therapy, or almost every type of psychotherapy, is going to include an insight component where your therapist or your counselor helps you notice things about yourself that maybe you have ignored or you did not notice because they came upon slowly or because you've just been living with. Okay, next up we have person-centered therapy. We've talked about this in a previous chapter. Person-centered therapy or humanistic therapy is a very empathetic form of therapy. It's all about listening to a person and making sure that they feel heard, and making sure that they feel they have someone who is on their side and cares about who they are and has empathy for them, so that you can get to a point where you can get over your problems by coming to terms with them. So there are two major components to person-centered therapy. The first one is active listening. In person-centered therapy, you have a conversation with your therapist, just like in psychoanalysis or any other type of talk therapy. But the way that your therapist is going to react to you is going to be a little bit different than with your psychoanalyst. So a psychoanalyst will try and interpret uh, things that are happening to you to figure out what the root causes of things are. In person-centered therapy, instead your therapist will try for active listening. And what active listening is, it involves a lot of very empathetically listening to what the client is saying or the person is saying, trying to ask questions that evoke more detail about what the person feels, trying to repeat back to them what they're saying in a different way or in a paraphrasing way. Often these repeating backs or this active listening results in a situation where things become obvious to a person, and so you almost start to, when you're on the receiving end of active listening, you start to notice things about yourself that seem obvious, but that are clearly troublesome that you hadn't noticed before. And so a lot of times when you as a friend are performing active listening for someone else, you may get this reaction where it's people kind of get frustrated because they'll go, "Oh my God, how dare you point out that I am judging myself in the same way that I would never judge someone else?" Or how dare you point out that I am saying that I need validation, but also that I don't need validation. And so those inconsistencies are something that we can have in ourselves and that can trouble us, but that we might not notice because we're living with them. And so that's kind of the point of person-centered therapy, is to help people notice things within themselves through this active listening. Person-centered therapy is kind of the therapy where you get that "how does this make you feel" sort of stereotype about therapy, because a lot of person-centered therapy is asking these empathetic questions, almost like a friend who really cares about you would have a conversation with you. Now, I'm not saying that therapy is something you get if you don't have a friend who can do this for you. But to some extent, therapy is kind of like that. Now, bear in mind, the reason it's different is that your friends are not responsible for your mental health, but they would probably care. Your friends may not be trained to do this, or it may not be part of their situation. And realistically, it's very difficult. If it's hard for you to be objective about yourself, it can be really hard for your friends to be objective about yourselves. Which is why a therapist is kind of like a really close and caring friend, but also not, if that makes sense. The second point, so we have active listening as a major point of person-centered therapy. The second point is unconditional positive regard, which is it's kind of like unconditional love. It's you want to make sure as a therapist that your clients feel that no matter what is going on with them, they are a good person, they are someone who deserves to be heard, and they are someone who you care for. They are someone who is at their very center a good person, but that may be experiencing troubles or things that make it hard to be who they could be. So, as with the psychoanalytic type of therapy, I have an example of a realistic version of what person-centered therapy might look like. This one's a little bit longer, but again, I'm going to read it out to you so that you can get an idea what this might look like. So in this case, we have kind of a transcript of a real therapy session that happened for person-centered therapy. So here we go. The client Rogers says, sorry, not the client, the therapist Rogers says, "Feeling that now, huh? That you're just no good for yourself, no good to anybody, never will be good for anybody. Just you feel like you're just completely worthless. Is that right? So those feelings are pretty lousy. Do you just feel that you're no good at all?" And the client says, "Yeah. That's what this guy I went to town with said just the other day to me." And your therapist goes, "This guy that you went to town with really told you all that? Is that what you're saying? Did you get that right?" And the client says, "Yeah." And so the therapist says, "I guess the meaning of that, if I get it right, is that here's somebody that meant something to you, and what does he think about you? He said that he thinks that you're no good at all. And the thing is, when someone who really cares about you says that you're no good, that's really gonna knock you out." And the client has an emotional response And the therapist says, "It just brings you to tears, huh?" And so they have this 20-minute pause, which I'm sure was very emotionally laden. And the client says, "Well, I don't care, though," defiantly. And the therapist says, "You tell yourself that you don't care at all, but somehow some part of you cares because some part of you is crying about it." And you can imagine this is a very emotionally laden interaction. Like I said, humanistic therapy, person-centered therapy is very much like what a friend might do for you who really, really cares about you. But it's hard for you to make these, it can be very difficult to get to these really caring conversations, depending on the situation that you're in and what your friends are like and whether or not your friends can be objective. It can be hard to be in this situation. So I'm not saying that your friends aren't good enough if they don't do this for you. I'm saying that this is something that they could do, but that not everyone is in a position for that, and not everyone is responsible or wants to do this. And so there's your example of person-centered therapy. It's such a personal and emotionally laden therapy. It's something that people would have a lot of trouble getting to because you really have to be very vulnerable in this person-centered therapy. But you can imagine how it would help someone get over something that they might not have thought about. And so in that way, uh, this and all the other types of therapies, therapies that we're going to be talking about, include a part of insight to them. In this case, the insight was the person had kind of internalized the idea that they might not be good at all. Okay, so next up we have behavior therapy. Behavior therapy has a big conditioning component to it. It's really simple. Behavior therapy is the approach in psychology that tries to teach people to change the way they behave. So um, it's not really too complicated if a person is constantly say shouting. They're letting themselves get angry. Behavior therapy is all about trying to change a person's behavior so that they don't do that. Ways behavior therapy accomplishes this is through positive communication, a little bit of that empathetic system already, making sure that people know exactly what is going on and why that might be a problem and what better solutions there could be. Informing people, say, hey, if you're feeling anger coming about, maybe you should try and do the count 1 to 10, breathe slowly, and then come back to the situation instead of responding immediately. Positive reinforcement is very, very common in behavior therapy, giving people gold stars or banana stickers or a calendar or something where they are clearly rewarded for improving their behavior, and of course structure and discipline. So some of the activities that we had in this class are very much a behavior therapy point of view. For example, we had an activity where you have an exercise calendar or a calendar that's all about trying to improve something about yourself, and you reward yourself with a star or some sort of sticker for every day that you did what you were trying to do. That's that positive reinforcement component. We have an activity where you do a sleep calendar. That's the structure and discipline. The sleep calendar sets some goals for going to bed consistently at a good time, and you're not necessarily rewarded or punished for achieving those goals, but by keeping a sleep diary, you are instilling a form of structure in trying to improve your sleeping, and so that creates a little bit of inertia or drive or push to improve the behavior of going to sleep consistently and going to sleep at a good time. So that's behavior therapy. It's a really simple and basic form of therapy, but that doesn't mean that it's not very effective. Just like with the humanistic approach or the psychoanalytic approach, you're going to include some insight here, although the insight is not that much of a major component, because usually the problems associated with behavior therapy are a little bit more obvious, like having anger issues or bedwetting issues or um, some other issue that's pretty clear. The insight comes from, well, what can I do about this and how can I approach the issue so it's better? Okay, counter conditioning is kind of a component for a lot of different types of therapies. It's in behavior therapy, but it's also in cognitive therapy, which we'll talk about a little bit. Conditioning, of course, is the changing of behavior through the association of things. To make this simple, if you have negative thoughts, your therapist might choose to shoot you with a Nerf gun every time you say something that's self-pitying. So this is actually a wonderful example of counter conditioning, because this therapist actually says he has a new tool for helping people recognize negative thoughts. And when people come to therapy, they get shot every time they say something that's really um, wallowing in self-pity or something like this. The reason it's counter conditioning is because you obviously don't want to get shot by the Nerf gun, but getting shot by the Nerf gun every time you say a negative thought is a clear way to help people identify the negative thoughts and move away from them. So um, I'll read this example here for this behavior modification therapy. I saw this post earlier about therapists, and it reminded me of my old therapist, Paul, who in my opinion is one of the greatest men alive, who did not put up with my bullshit for even 1 second. Anyway, I go in to see Paul one week in the summer of 2016, and I'm doing my usual bullshit, which consists of me talking shit about myself, and Paul is staring at me. Then he cuts me off and says he's got a new tool for helping people recognize when they're using negative language. That would be, for example, saying, I'm so stupid, or really this person saying that they're talking shit about themselves, or saying, I'm not competent, or I'm useless, or I should know better. So Paul gets up and goes to his desk, and the client says, okay, all right, great, hit me with that sweet self-help article I'm in, because I'm a linguistic learner, and Paul's always like giving me a tool that's a book or something. I have a tool for you, and it's pretty much always an article or book or something. And so Paul opens the drawer, and he takes something out and turns around, and I stare at what he's taken up, and I say, Paul, is that a Nerf gun? And so Paul had this Nerf gun that he shoots clients with when they've been saying bad things, and helps them change their behavior. In the same way that you might spray your cat with a water bottle because they've done something bad, you could hit your client with a Nerf gun when they're saying negative things about themselves. Exposure therapies are kind of a behavioral part of therapy. That often helps people deal with phobias. So if they're unrealistically afraid of something, an exposure therapy is a pretty common way to deal with that. If you're afraid of spiders or flying or dogs, exposure therapy can help you. And the main idea for exposure therapy is that you are slowly exposed to the issue or the target of fear until you feel better about it. So if you are deathly afraid of dogs, you might be exposed to a cartoon of a dog, or a movie with a dog, or a picture of a dog, and then you might be exposed to puppies, which are cute and harmless, before eventually being exposed to a big, scary dog that you'll still be exposed to. But over the time that you're exposed to these more and more dramatic exposures, you will eventually be desensitized to the problem that you're dealing with, and it will make you feel not so afraid of it. A version of this is virtual reality exposure therapy, where people put on a virtual reality mask and they are exposed to the scary thing over time in this safe environment. Well, there's no actual dog or spider or plane or whatever, but because you're exposed to it, you get used to it and it stops being scary. It's kind of like, what's the best way to get over a fear of the dark? Go into the woods at night, a really dark place, with a friend. And you hold their hand and they're there with you. And then the next day, go into a dark place by yourself, and you're exposed to that scariness, but you get used to it and you find out that it's okay, and it makes you feel better. More information here on exposure therapy. What goes on in exposure therapy is systematic desensitization, which is the improvement of your relationship to the scary thing over time. You get desensitized to it because you experience it. So as cartoon here on the left, you may have a scale where you identify how scary or how messed up you are by the scary thing. I think this one's pretty straightforward. Another aspect of behavior intervention therapies is going to be aversive conditioning, very much like hitting someone with a Nerf gun whenever they say something negative. Aversive conditioning is where you try to change how people think or how people act by making the undesirable behavior or thought less desirable, even by punishing it somehow. So if a person has a drinking problem, that's a behavioral problem, they tend to drink, what you might do is have them drink. Yeah, great, but put something in their drink that will make them sick or that tastes horrible, so that they associate the drinking to really horrible taste or being sick, so that they will not want to drink anymore. Another example of this is whenever someone is going down a negative mental spiral, to literally hit them with an air horn. Not like physically, but blast them with that annoyingly loud sound, and that helps you say, hey, I'm doing this thing that is silly. I should stop and change. It's a great way to help people recognize that they're doing something that's not great, or that they're thinking in a way that's not great, and to do something about it. Um, a lot of times there's a two-part plan to behavior therapies. The first is recognizing the issue and learning strategies to deal with the issue, but the second is practicing noticing the issue in the moment that it's happening and employing those strategies. And so both of those things can be pretty difficult. So the aversive conditioning is what you do to help notice it, whereas the therapy or the conversation is what you do to realize what's going on and learn about what you can do better. There's also a token economy, which I kind of mentioned before. This is a vocab term for it. The token economy is the idea that you condition a person, or you try and help them improve their behavior or their thinking by giving them sort of token. So this would be like the sticker you put on your calendar when you do good. If you're trying to learn to drink more water, you might put stickers in your calendar whenever you drink enough water for the day. Or you might get a candy or a pat on the head, just some token to identify that you did better. You did great. Okay, next type of therapy. Cognitive therapy is a therapeutic approach that is designed to help people change the way that they think. A lot of people think that it's impossible to change the way that you think, but that's just not true. Cognitive therapy is all about changing the way that you think. If you are experiencing a thought storm, like a negative spiral where you're telling yourself that you're stupid, and telling yourself that you're stupid makes you feel stupid, and it gets worse and worse and worse. I sometimes have a problem where I'm hanging out with my friends and I start to feel uncomfortable, and then I'm trying to think about ways to not be uncomfortable, and then I start feeling more uncomfortable. I start to feel like I might be a burden on my friends, and then it gets worse and worse and worse and worse. So cognitive therapy is all about changing the way that you think, because in reality, thinking is habit forming, just the same way that anything is habit forming. And so if you have the habit of thinking negatively about yourself, once you fall into that, the habit's going to get worse and worse and worse. And every time you do it, it's going to get you ready to have that negative thought as well. So cognitive therapy is all about noticing those patterns of thinking and changing those patterns of thinking. So we've got here a slightly more advanced version of cognitive therapy. The more common version of cognitive therapy is something called cognitive behavioral therapy, and it kind of merges both cognitive and behavioral therapy together. Cognitive behavioral therapy is an integrative therapy that combines cognitive and behavioral therapy together so that people can A, change the way that they think, and B, change the way that they act through the identification of these habits and decisions to make those habits better. So cognitive behavioral therapy acknowledges that thoughts and behaviors and emotions kind of interact with each other, cause each other, and create a cycle. And so if you think that you're stupid, you will be less confident and act worse or act in nervous ways. If you think that you are not socially apt, you might choose to not go out with your friends, and that will make you feel even more so that you're not socially apt. And so cognitive behavioral therapy is all about changing your thoughts as well as your actions so that you completely change the cycle of thoughts and actions there. Here's a very simple but helpful example of a cognitive behavioral therapy situation. So if you lose your job, you might naturally think that you're worthless and that life is a hopeless situation, and you might get depressed because of that, and you would maybe stop applying for jobs. Another thing that you could do, you could change that habit, and if you lose your job, say, okay, instead, maybe that wasn't the greatest job for me, I deserve to have a better job, or they didn't appreciate me. And something else that you could do is apply for more jobs, or do some personal training so that you have activities that are improving your life instead of just making you feel worse about it. And then that's going to change the way you react to losing your job to being a non-depressive reaction. Much better. Okay, we have more examples here of therapies that are pretty cognitive behavioral in their nature. So Beck's therapy for depression. First, show the depressive clients that their thinking is irrational. So through some sort of conversation, maybe humanistic therapy, help them notice that the way they're thinking is ridiculous. Like if they say, I'm never going to get another job, or I'm never going to be good enough for my girlfriend, make sure that they're aware that that's crazy. And then help them reverse the negative views of themselves by explaining that their situation is not hopeless, that they can get better in the future, giving them examples of situations that have gotten better, or show them that they are trying and that trying has value. Gentle questioning helps reveal that irrational thinking and persuades people to change their views on life. So there's kind of that humanistic, but even cognitive behavioral therapy includes this gentle conversation aspect. Next up, catastrophizing, relentless, over generalized self-blaming behavior is something that you see in people who have depression, where it's like, I'm never going to be good. Well, maybe you weren't good enough last time, but that doesn't mean you're never going to be good enough. Therapists teach people to help alter their thinking in stressful situations. So the next time that you get stressed out, you don't immediately start blaming yourself and thinking you're worthless. The next time you get stressed out, you might get a little bit better. And the next time you might get a little bit better, and eventually you can deal with stressful situations in a great way. So the research shows that learning to talk back to negative thoughts can greatly reduce the rate of future depression. So it may be that having negative thoughts is inevitable. Everyone sometimes feels like they're stupid or incompetent, or everyone makes mistakes, and everyone berates themselves for making mistakes. But the way you respond to it is what matters. If you say, yeah, that was a stupid thing to do, instead of I'm stupid, and next time I'll do better. Making a plan to do better, or committing yourself to do better, doing something positive for the future. That's how you get to a much better mental place. Okay, so we've got a list here of cognitive behavioral techniques. I don't really want to go through all of them. I would encourage you to take a look at them yourself, but the biggest thing about cognitive behavior therapy is that you can change the way that you think. And so identifying negative habits that aren't very useful in you, and changing those habits to be more helpful is the root of cognitive behavioral therapy, and it's really what all of these different techniques are about. So if you'd like, please check this out and see if any one of these might work for you, or try them out next time you're having trouble within yourself, or if you want to help a friend who's going through a tough time. Okay, so we have two therapies that are pretty similar here. We have group therapy. Group therapy is therapy conducted in a group, and really it's conversation therapy. It includes components of cognitive or psychoanalytic or cognitive behavioral or humanistic. The whole point of group therapy isn't necessarily a specific style, but it's an approach. It's the idea that sometimes people benefit from having conversations in groups. So what's great about group therapy? Well, you can check out the link at the end of the chapter if you'd like, but a couple quick points. Sometimes it's easier to have a conversation about your problems if there are other people in the room who have similar problems and are talking about them. Sometimes it's easier to listen when the advice is given to someone else, because you don't have this pressure to accept or decline the advice. It can be easier to learn things about yourself when you see the parallels in other people's lives about it. And sometimes it's just easier to have these vulnerable conversations in a group than in a one-on-one conversation with your therapist. Family therapy is group therapy for families. A lot of times, say a husband and wife are having a bad dynamic, or parents and children are having a bad dynamic, and by going into therapy as a family unit, you can benefit a lot from seeing how those family members react to each other, and giving people the opportunity to say how they feel about a situation, and together making a decision that you want to get better. Creates a kind of a feeling of solidarity, creates a really good opportunity for the whole group or the whole family to improve together. So anytime you have a collaborative psychological issue between, a husband and wife, or parents and children, or even two friends, there's nothing wrong with going in for family therapy or group therapy to work through that. Okay, so we've talked about the major types of therapy, and that is the majority of the material in this chapter. We're now going to take a quick look at seeing, well, how can we tell how good therapy is, which therapies are worthwhile, uh, you know, spoiler alert, it's the ones that we've talked about, and which therapies are not worthwhile, well, we'll mention that, and what makes therapy worthwhile. If you're trying to assess whether therapy is useful, it's important to be aware of a couple things that can change your opinion. First of all, usually when you go into therapy, you are experiencing some sort of crisis or emergency. You might go into therapy because you've fallen into depression, because you've lost your job, because you got in trouble legally, because someone tried to tell you that you have to do it. There's some sort of major problem going on. So when you go into therapy, you have this problem, and that makes you want to believe that the therapy is going to be effective. So clients want to believe that treatment is effective, and they generally are going to want to speak positively about their therapy therapist because everyone wants to say that things are working. No one wants to talk about their therapist negatively, because why would you want to think that my therapist sucks, that you're wasting your time? And so generally clients want to believe their therapy was worth it. And so it can be easy to overblow the value of therapy. And there is research that shows that there is a big placebo effect in therapy. That being that just going into therapy benefits you regardless of the type of therapy that you go into. Now, let's think about this placebo effect. If you are trying to improve your mind, if you're trying to improve how you feel about things, and the improvement comes from simply trying to improve instead of whatever therapy you actually went through, is that a bad thing? Realistically, there's nothing wrong with a placebo effect improvement in your life. You know, some people improve their mentally, their some people improve their psyche through therapy, and if they improve just because they think that they're improving, it doesn't matter because you've still achieved improvement. The same thing can be said for something like religiousness, or as a therapy, or doing exercise, joining a club as a therapy. I'm not saying that these are placebo effects, but I'm saying that just by doing something to improve your life, you will get some benefit. Because, unlike a medicinal situation, if you are trying to get better and you do get better because you feel like you're getting better, then you are getting better. Does that make sense? Did I say better too many times? Um, let's talk about how much better one therapy is than another. Realistically, there's not a huge improvement or difference in different therapy types. Usually, people who attempt therapy are going to improve to some extent compared to people who don't attempt therapy. And it's important to recognize that because you usually go into therapy when you have some sort of problem, you're always going to improve because most people's problems improve over time. And so because you do therapy over time, you're probably going to improve anyway, although therapy does give you a bit of an edge. Different therapies work better for different people. Like I said, if you're a very religious person, um, talking to your pastor or talking to other people in your religious group or just participating in your religious group more so may be more helpful to you than if you have a therapist that's like an atheist, because there's clearly going to be a disruptive issue there. But regardless of what you do, most therapies are beneficial for you as long as you go into the therapy thinking that things are going to work or that you're going to put effort into improving yourself, because that's really the heart of therapy, having people put effort into improving themselves. There are some types of problems that are better solved by some types of therapies. For example, behavioral conditioning is best for really clear behavior problems like phobias or compulsions. Like if you always need to wash your hand, it makes sense that you might be rewarded for washing your hands only 2 or 3 times a day versus 30 or 40 times. If you have marital problems, if you are wetting the bed, if you are compulsively drinking or gambling, it makes sense that behavior conditioning would be a good way to deal with that. Psychodynamic therapy, it's kind of related to psychoanalysis, is going to be great for depression and anxiety. It helps you uncover your problems and talk through them and find ways to get better with them. Person-centered therapy is going to be great for moderate depression, and it's one of those. Person-centered therapy is also pretty good for maintenance or preventative care. So if you have some issues that have not really become a disorder, but that could become a disorder, if you have a little bit of depression, if you have recently experienced something that's traumatic, but you are not really falling into huge debt, or you haven't been fired from your job yet, but you are in that danger, person-centered therapy is wonderful for all of those things. Lastly, cognitive behavioral therapy is great for anxiety, depression, PTSD. As a cognitively trained person myself, I kind of feel like cognitive behavioral therapy is great for everything, but realistically, every therapy is effective for everything, and it may just be your specific problem or your specific personality that would benefit from these different types of therapies. Just like with medication, it's always great to get a second opinion or to try different things and see what works best for you. Okay, so after having said that a bunch of different therapies are effective in different ways, it is important to recognize that some therapies are just unrealistic. There are energy therapies, therapies that are designed to manipulate people's energy fields. This is pretty like magical. Therapies like Reiki, you've ever heard of that, or aura therapy, or even certain types of massage therapy for psychological issues, or acupuncture for psychological issues, it's not a really realistic way to help people improve psychologically. Recovered memory therapies, memories that rely on finding what happened in your childhood that is the problem, those are really not helpful. Recovered memory is something where you're looking for a problem, something bad that happened in your childhood that you forgot. The idea behind that recovered memory is that once you figure out what it is, then that liberates you from that psychological burden. That's not really realistic. It was pretty big for a while, and people, that would sue their family members or their pastor or whatever because they said that they remembered that they abused them sexually. Sometimes it was true, sometimes it was not true, but it doesn't actually help you psychologically. Um, what helps is the recognition of the problem and the attempt to improve it, not necessarily the remembering of a specific issue. Rebirthing therapies is another really weird one. The rebirthing therapies have the idea that children can be problematic or disruptive because they have some sort of trauma stemming from being born. The idea is that being born is a very traumatic experience. That's not really very true. Everyone is born, and it's something that is pretty damn natural. It can be traumatic for the wife, or sorry, for the mother, or for the husband, or the father, or whatever. I'm not trying to normalize things there, but that doesn't mean that it's really a problem in your child. And more often than not, if your children are having problems, there is some sort of issue that we can figure out from other types of therapy. And using the DSM to figure out what the issue is very helpful as well. So a rebirthing therapy is a situation where you perform kind of a ceremony where your child goes through like a rebirthing. A lot of times they will be pressed or they will be pushed under something, maybe pillows or like a little tent, and they have to like come out of it, and the idea is that they have to like learn to fight for their own lives. It's really not something that works, and unfortunately rebirthing therapies have resulted in the deaths of children because they were being pressed so much that they choked. Some therapies even were so bad that the children soiled themselves or threw up on themselves, and they were pressed so hard that they lost their lives. And that's a very unfortunate outcome, and it's really not anything that helps children at all. It's a terrible thing. Lastly, conversion therapy is another very terrible thing. Conversion therapies are all about trying to change a person's sexual orientation or gender identity. It's about trying to convert people who are gay to being straight. It's about trying to convert people who may be trans to being heteronormative, or it's absurd. None of the conversion therapies work. There's no research at all showing that changing a person's gender can help them psychologically. The only research in reference to that is all about showing that if a person is not uh, experiencing life as the gender that most fits them personally, then they will have problems. If a person has a body that doesn't fit their gender identity, that can cause problems. So conversion therapies are realistically the opposite of helping someone, and for the most part they don't stem from real psychological desire to help someone. They stem from, unfortunately, a religious idea that people should be a certain way, which is not necessarily the way that they actually are. It's not a very self person-centered therapy. And so, you can clearly tell that all of these therapies lack one of the unifying aspects of all therapy, which is empathy, listening to a person and trying to learn what's going on with them. And I do want to mention what the unifying qualities of therapy are. And you can kind of point out these three things. First, all therapies that work have a component of hope to them, making sure that people feel that they can get better or that their lives can get better and that everything is not lost. A big part of a therapist's job is making sure to help people feel more positive about their lives. And when you feel positive, you can start to see things more clearly. Therapists will help you have a fresh perspective on things, not just help you understand how things are working for you in a more realistic way, but help you notice that you are treating yourself poorly. Help you notice that life isn't totally ruined. Even if you've hit rock bottom, life is not totally ruined. You can still have a wonderfully happy life. Notice that even if you're not like the movie star or rock star that you want to be, that doesn't mean that your life is ruined. And finally, having an empathetic and trusting and caring relationship. That is possibly the most important part that a therapist can play for you. So, therapy, like I've said from the beginning of the semester, psychology is all about communication. And how can you best achieve communication? Then, how else could you best achieve a communication than by giving people hope, giving them objective perspectives on things, and listening to them and caring for them and making sure that they feel that they are worth something. Okay, so I believe the American Psychological Association puts out these guidelines. It has this guideline to help you identify a situation when you might want to seek therapy. A lot of people feel as though they have problems, but their problems aren't enough to warrant help. If you ever have a problem, it's enough to warrant help. If you are alive, it's enough to warrant a little bit of therapy. In the same way that, you want to take your car in every 5,000 miles to make sure things are going okay. You want to go to your dentist twice a year, and you want to go to your doctor at least maybe once or twice a year to get a checkup. There's nothing wrong with going to a therapist here and there. And of course, if you're experiencing any of these following things, that's a great time to go to a therapist. So if you're feeling hopeless, if you feel like you have a long-lasting depression, if someone dies in your life, it's okay to be depressed. But if that depression lasts for more than a couple of days or weeks, then maybe you have a disorder that you need help with. But grieving is a totally normal part of life. Being sad is a normal part of life, and there's nothing wrong with that. Self-destructive behavior. If you are abusing substances, if you're hurting yourself, if you're putting yourself in danger, you have problems. And it's important to notice that these really matter. These really come from those 4Ds of abnormality or of problems in disorders. If you need help remembering them, or if you'd like a reminder, realistically, you should seek out mental help. If you are experiencing distress, there's something that you are not happy with, or that makes you feel uncomfortable about your life or who you are or how you act, if there is something dangerous happening to you, or you're hurting yourself or someone else, if your life is being disrupted in some sort of way, if you are unable to live, or if you are unable to hold on to a job or hold on to friends or loved ones, or if there's something that's just not letting you live normally. And finally, deviance. If you are experiencing a situation where you think or do or act in a totally weird way outside of what you would consider common or normal, those are those 4Ds, and they're pretty much reflected in this list that helps you identify what I am experiencing. So thoughts of suicide, obviously danger, obviously disruptive, obviously is something that you might feel uncomfortable with. Sexual difficulty, compulsive rituals, hearing voices. Like I said, these are all examples that come from that list of 4Ds. Okay, so where the next thing we're going to talk about, I think I have a little bit of a disorder here. The next thing I wanted to talk about is an overview of things that your therapist might do, things that you might do in therapy. Remember that a good way to summarize how you're going to change yourself or your personality or your behavior in therapy is to first identify what changes in your lifestyle you can make that can influence your brain and body and influence your mental health. And so part of the medical approach to therapy is to change the way that you live that can improve your life. Some people feel depressed, but they may not notice that they're depressed because they're not getting enough sleep, or because they're not interacting socially with people in positive ways. And so here, let me put this through a clear set of examples that will help you make sense through this wonderful little infographic. So we are designed for physical activity and social engagement. It makes sense that our ancestors who hunted in groups and worked together in groups outside benefited from being outside. And so in modern day situations where we spend all day inside, of course that's going to make us feel bad. Of course it might make us depressed or anxious or anything else. So being outside and doing physical activity can help us. Making sure to exercise at least 30 minutes a day or 3 times a week helps you feel more positive and happy, and it's wonderful for your mental health. Um, in fact, not is exercise only helpful for you mentally, but it actually improves the help that medicine or that antidepressants give you. Being exposed to direct sunlight or natural light for at least 30 minutes a day, especially in the morning, is wonderful for you. If you have one of those overnight jobs where you sleep all day and work at night, you can see how that might be hurtful. Working on changing your behavior by reducing rumination is beneficial. Remember, rumination is when you're overthinking these negative thoughts, so practicing changing that habit so you're not constantly focusing on negative things is going to help you, of course. Making sure you get adequate sleep doesn't seem like it might necessarily hurt you, but if you can't sleep very well, you can't think adequately, and it can drastically reduce the quality of your life. Making sure to have positive social connections, so less alone time and at least 2 meaningful social engagements every week is so helpful for you. It seems obvious that having positive social engagements with people is a great way to improve your quality of life, but um, it's not something that everyone engages in, and it's something that everyone deserves. And of course, natural supplements, things like taking vitamins regularly can drastically improve the quality of your life. So we have a lot of these medical things here, and so I guess I don't have this in this order. The biomedical practices that can help improve your life are going to include a lot of those physical health improvements or habit improvements that we just talked about. But of course, the most obvious aspect to biomedical therapies is going to be medications. And so there are 4 major types of biomedical medications that people usually talk about when they talk about biomedical therapy. And so I would first like to start by mentioning that a combination of medical or drugs and psychotherapy is always best. I would always encourage people to seek out psychotherapy before drug therapy. In my opinion, medical therapies for psychological problems are a uh, short short-term solution that helps you if you are experiencing major distress. If you're feeling suicidal or if you're feeling, life disruptive anxiety, taking medication for it can help you get over it long enough to have the therapy help you or have changes in your lifestyle that will help you. Of course, that is not necessarily true for situations where you have a psychotic problem. So psychotic problems are usually lifelong problems or maybe temporary, but they are problems that are really medical in nature. And so that's where our first drug comes in. Antipsychotic drugs help you treat psychotic symptoms. As a reminder, psychotic symptoms are those where you have disassociated life from reality. If you are experiencing hallucinations, if you are unable to see the world for what it actually is, if you feel you have paranoia, if you have catatonia, these antipsychotic drugs help you deal with that. Unfortunately, there are some side effects. A lot of motor control side effects pop up with antipsychotic drugs. For example, people may have shaky hands, they may be less able to react to things consistently or efficiently, but a lot of those side effects are usually nowhere near as bad as the things that they're trying to help with, those psychotic symptoms. So, what's a little shakiness when you were previously afraid that the government was constantly trying to kill you? An example of an antipsychotic drug is Thorazine. Next up, anti-anxiety drugs do kind of exactly what they say. They help calm or reduce or prevent anxiety-laden thinking. Now, here's a wonderful example where therapy is very important. Anti-anxiety drugs do not really treat the problem, they treat the symptom of anxiety. And so what you want to do is, if your anxiety is overwhelming, you take the drugs so you can help prevent your immediate life problems, but your therapy is it's what's going to stop those long-term issues from coming about. An example of anti-anxiety drugs is going to be Xanax. It's probably pretty fairly well known. Next up, antidepressant drugs. Antidepressant drugs are for elevating your mood, making you feel more positive and happy and joyful. It helps you feel joy if you can't feel joy at all. So antidepressant drugs, unsurprisingly, are for treating depression, but they are also helpful for stress and anxiety situations. It's kind of confusing. Why would an antidepressant help anxiety instead of an anti-anxiety drug? You can think about it this way. Anti-anxiety drugs reduce anxious thoughts. Antidepressants increase your mood. So they kind of have different jobs. And I believe that in certain situations, people have combinations of those. But again, as with anti-anxiety drugs, antidepressant drugs are best paired with therapy. There are some situations where just biologically your body does not act the way it is supposed to, and so an antidepressant drug might be something that you need to take in a really long-term situation. That's something that maybe you have to think about, but it's always going to be something that improves with that it's best paired with therapy. It's important to note that antidepressant drugs are not necessarily always better than placebo effects, so that kind of counters that issue. Depression is something that that is difficult to explain, but I know, we all know for a fact in psychology it is for sure that it is a combination biological as well as mental problem, and so medication as well as therapy is going to be the best route for that. Give it as many direct forms of attack as you can, if you'd like. And so an example of an antidepressant drug is going to be Prozac. Finally, mood stabilizing medications are going to help out smooth out mood. So these are going to be for helping people stop being manic and depressive. So if you have really high highs and really low lows, mood stabilizing medications are going to kind of even those out. So you have a more even temperament all the time instead of a really excited and really sad temperament sometimes. These are highly effective for reducing immediate problems. So people who are manic depressive may have a chance, a danger of suicide or of self-harm or some sort of problem to their lives, and these mood stabilizing medications help smooth that out. A good example of this is lithium, which is not necessarily a complicated medicine. It's actually a simple salt. It's a simple compound, and it's quite cheap. And so if you feel as though you have really high highs and low lows, or any situation where you have extreme emotions, and especially longer lasting extreme emotions, mood stabilizing medication can be helpful for you. And again, that's dealing with a clear biological component. Okay, so we have a couple more therapies here that really have biological components to them. One is called electroconvulsive therapy, or ECT. That is therapy where you get an electric shock through your head, through your brain, to try and help some problems that you may be feeling. Electroconvulsive therapy is quite old, and it used to be employed for a lot of different things. We now know that it doesn't work for everything, but it does have some things that it helps you with. The most famous or notable is that if people have extreme depression or convulsions, um, electroshock therapy can be very helpful. It's almost like zapping your brain to do a restart, kind of like a restart on a computer. It can immediately reduce depressive symptoms and help you think in different ways. It can be really effective, but there are a lot of negatives to it, and it is a very drastic therapy. It's not really something that you would go for unless it's a last option for a really extreme version of depression or a really, really long-lasting version of depression. Uh, a much less drastic but still physical form of therapy is something called repetitive transcranial magnetic stimulation, or TMS or RTMS. What this is you see there's like this metal 8 or hoopy hoop thing. It is a special type of magnet that shoots magnetic waves or electricity into your brain. It doesn't directly connect to it. You don't open up your head. But it's just like kind of a wand. It almost looks like the stick you use to beat your carpets or your mats to get stuff out of them. And it helps reprogram your mind by stimulating certain parts of your mind so that it activates them more or less, depending on how you interact with it. It's used to help depression, and it's kind of a newer thing. Your textbook mentions it, but I'm not really sure I've ever seen it as a form of therapy. I'm mostly seen it in research. There are ways that you can use it, say, to activate or deactivate your arm. For example, after I think 20 minutes of exposure to it, depending on where you put it and how you configure it, you may be unable to move your arm, or your arm might move by itself. And so it's a really cool way to stimulate the brain uninvasively and not dangerously, but it's still pretty new. Another way to stimulate you is something called eye movement desensitization and reprogramming or reprocessing, also known as EMDR. This is a type of therapy that kind of comes from a psychologist who noticed that when they're walking around in the forest, they have a tendency to slowly move their eyes left and right. And the way this therapy works is that you do, in fact, look at a machine like this that has this light that goes left, right, left, right. I think usually it's a bit slower than this. It's designed to help your brain change the way that it's thinking. You may notice that it's most, when you look at things, your eyes kind of want to dash to one place, look at it, dash to another place, look at it. If you're riding in a car, it's easy to notice this. Try to just stare at one spot instead of looking at different things while you're moving in the car. It can be really hard. Getting your eyes to move in this rhythmic, smooth way engages different parts of your brain that may not normally be activated, and so it helps you think in different ways, and it can be helpful for treating things like PTSD, panic attacks, eating disorders, anxieties, or addictions. As with every other type of therapy, it's always best when paired with psychotherapy, but it's the kind of thing, almost kind of like ASMR, that you can kind of do on your own at home with maybe mixed effects. There are some questions about how beneficial this can be or whether it's just a placebo effect, but it is something that exists, even in the local town Springfield. There are maybe a couple, two or three people therapists that employ this or employ it, and you don't necessarily need a machine like this. You can do it probably on a computer or with a phone, or even just your therapist waving their hand rhythmically or your finger rhythmically in front of you and having you follow it can benefit from that. And so it might be something that you can do to yourself. um, if it works, great, but just to make sure you're aware of it, because it does pop up here and there, and it's kind of cool. Next up, the last thing on this chapter, psychosurgery. This is any type of surgery that physically alters your brain, either cutting it, removing a part to it, or mixing it up, or adding something to it that's designed to help you. Psychosurgery is kind of an umbrella term for any sort of surgery on your brain. There are some sort of psychosurgeries that involve nerves in different parts of your body, but it's usually going to be part of your brain. And usually psychosurgery is intended to solve some sort of psychological problem. It's not really a very common thing because, it is invasive, it is permanent, and it can be really hard to perform, and there are really much better solutions before getting to psychosurgery. The most common type of the most famous type of psychosurgery is a lobotomy, shown here on the right, where you stick a needle through a person's eye, not really through it, but kind of through the eyelid and around it. It doesn't damage the eye at all, but it's still pretty terrifying, and that gets you to the brain. Sometimes it's done through the nose, and you literally stick it in the front part of your brain and run it around to mix it up and destroy it, almost like you would destroy some jello with a fork. It's a quite terrible procedure, and it does smooth out people's emotions. They become docile, and it was used historically to help deal with people who were overly angry all the time or disruptive all the time. It is not something that anyone endorses anymore, and it is not something that people do anymore. And if it does happen, it is functionally torture. Uh, because it's not something that's really helpful. You are damaging possibly the most important part of someone's brain for being totally alive, and people who get this surgery do improve. They get less angry, disruptive, violent, but they also don't think as clearly as they used to. They are less intelligent. They make less intelligent decisions. They just do so in a more positive light. So people used to do this, but it is terrible, and it's not done anymore. A more common a more modern common type of psychosurgery is split brain surgery. We've learned that there are two sides to the brain, the left and the right. Cutting the corpus callosum, which connects the left and right side, is a type of surgery that can help you for a couple of different reasons. Medical reasons include epilepsy or major tumors or seizures. There are some psychological reasons why you might do it, but for the most part, it's again a kind of a last choice for psychological things. And so, as with all psychosurgery, it's not really something you should go to. But there you go. That's pretty much all the information for this chapter. I've got a list here, just a summarizing table for all the different types of therapy that we talked about. And so I would really encourage you to read through the list on your own time and of your own volition to see if there's anything in here that makes sense to you or to help you review these different types of therapies. If you have any questions, feel free to contact me and I'm happy to answer them. But that's it for the material for this chapter, and it's it for the material for introductory psychology. I really hope that you've enjoyed the material here. I know it's been kind of a rocky year and we're all working to do our best, so I wanted to try and make this a simple and easy class with not too many components to it. And I hope that you can employ some of the things that you've learned here, not just in this chapter, but in the whole class for your own life. So this is Gabriel, and I'm signing off for this class. I hope you've enjoyed the material and have a wonderful day. Take it easy.